Okay, so we'll have the session 8 of Coffee and COVID today. And as everyone knows, we are IMAGINEi5. So Sarah, Adriana, and Clarice are members of IMAGINEi5. And let's have some update. Every Monday and Friday, 10 a.m., we will have Coffee and COVID when we will usually host the Friday session around 10 a.m. And we have a few forms attached here. You can, we have another MVP session next week. So like if you have an MVP ready, want to get feedback, please fill in the form. Of if you want to apply to be the mentor, please fill in the mentorship form as well. And if I assume everyone is part of COVID Accelerator, but if you're not, we have a form here. We welcome to join the community. And also, please update and add your work into the Airtable so you can allow us to promote you and keep us in the loop about your needs.
Thanks. All right, so new style, what up? So Tom actually fixed, he changed up the format of our Airtable. So thank you to Tom. And if you guys can, please go in, update your information, add some pictures. This will catch people's eyes so they can read more about what you're working on. And also at the bottom on each tab, you have kind of what your needs are. So maybe that's like more user testing, somebody to join your team that has a particular skill set. So, you know, make sure to put that information, keep it up to date, as Clarice mentioned. So thanks again to Tom for that. And so today we're going to introduce our MVP mentors. So Alex, if you don't mind, can you kind of share a little bit about yourself?
Hey, how's it going, everyone? My name is Dr. Alexander Baraday. I just graduated from medical school at Florida State University College of Medicine, and I matched into a dual residency in combined internal medicine psychiatry at Medical University of South Carolina. I'm originally from California, and yeah, I was invited here by Sarah, and I'm glad to help however I can.
Awesome. And then Jody, if you don't mind introducing yourself as well.
Hi, everyone. My name is Jody. I am currently a senior product manager at the Men's Warehouse and Jose Bank, working on internal store applications that are used by consultants throughout our stores. Invited here by Adriana and Sarah, and just super excited to think about MVPs and contribute however I can.
And Juan, you got the stage here.
Hi everyone, I'm Juan from Colombia. I'm an industrial designer with a master in strategic design. I live in Berlin since the past 8 years, and I work as a product designer slash facilitator slash UX designer in the healthcare sector. So we develop platforms and apps for patients that are doing rehabilitation of operations in knee and hip. Is how the word in German. And yeah, I'm just happy to be here helping with MVPs and everything I can with prototyping, since basically I've been doing that for the past 6 years.
Awesome, thanks guys. So we're gonna match up these mentors with the 3 teams that are presenting today. So I'm gonna let Anne actually take it away for Health Communications Partner.
So the idea of this section is for you to present your MVP, so that whenever we go into breakout rooms, we can get started with the feedback and all that stuff. So here's your spot, your 5 minutes of MVP presentation.
Sure. All right, so let's see if it'll let me play it. There you go. Hi, I'm Dr. Anne-Marie Liebel, different kind of doctor. And this is about reflecting on bias in digital health. And I have there an image of some of the most popular kinds of digital health tools. So this is about all of those. The health sector's future is digital. But as we know, there's bias in digital products. Bias in AI and in data is well known. But what doesn't get talked about so much is that bias is possible at all stages of the project lifecycle, because as humans, we are biased. Digital health is transforming healthcare systems worldwide, and it promises benefits for population health, but it might also lead to health inequities because of the biases that are in digital health tools. Now, there's a lot of reasons for these biases, but I'm just going to focus on improvements that can be made in the design and in the content. There's that citation. I want to focus on the idea that accessibility can be broadened to include women, people with disabilities, racial and ethnic minorities, and I'll let you read those, right? So that what we typically think of as accessibility can be broadened to reduce some of the biases in digital health tools. Now, there is some guidance available so far on how to do this, but the guidance itself is limited by what's called the ethnocentric bias. And that's our tendency to kind of normalize our own worldviews. And unfortunately, that tends to have another consequence, which is we see people who are different from us as somehow less than us. And that gets called the deficit perspective. So what can happen when a deficit perspective creeps into digital health tools is that they might unintentionally worsen the inequalities that they are there to help address. If you hear or see something that makes you think of Ursula in the background singing Poor Unfortunate Souls, that's probably a deficit perspective. So reflecting on bias in digital health is an on-demand asynchronous course. That's for anybody who purchases, researches, designs, develops, or evaluates digital health tools. It's through Health Communication Partners LMS or yours at your organization. And what will you learn? You'll learn reflective practice as a method for innovation. You'll learn about questioning assumptions that are made along the project lifecycle. You'll learn about that ethnocentric bias and the deficit perspective. And most importantly, you'll learn how to inform process improvement at your organization. Our asks are two. Because many of the people on this call are the learners that we would hope to serve, what would you really hope to take away from a course like this? Because I also co-create the courses. And then how does your organization typically offer courses? Because there's various modalities that we could go through to get this in as many people's hands as possible. That QR code goes to hcpartners.com specifically to, I run a podcast series and I've done several episodes on problems in digital health tools, and that QR code will take you to those episodes. So thank you very much.
I'm Scott, and then I'm going to be an incoming freshman at Georgia Tech next year. And Lucas, do you want to?
Yeah, sure. I'm Lucas. I'm a rising sophomore at Harvard, and I founded the coronavirus visualization team this April. And so the mission of the coronavirus visualization team is to fight the infodemic. So this is the collection of misinformation, this overinformation that everyone is grappling with today. And we're doing that from a specific student-based perspective. So the way we're doing that is with three clear objectives. So one is, of course, creating these high impact visualizations that look on nuanced and niche data. So often looking at perspectives that are missed in the mainstream media. Two, amplifying the work of frontline experts and organizations. So a lot of our partners are some of the other people who are presenting today. And then, of course, retaining that student focus by connecting these students to research projects with our partners. So at the moment, we have over 1,000 members in our community, 200 active members across over 25 projects. And each of these projects is paired up with an expert. So a mentor, say that's a university professor or say a data scientist, as well as a partner organization. And with each project, most of them are currently in the middle of their timeline. And as you can see here, we started off really quickly. And now that we have all the structure, we're poised to really begin publications and following through with our mission.
And yeah,
so I want to quickly also walk through the work that, began everything, as well as I'll let Scott take on some of the partnerships here.
Yeah, so currently we are a VIP member of the Harvard Innovation Labs, where we receive some mentorships and one-on-one calls. We are partnered with the Harvard Center for Geographical Analysis, where we're connecting students to different research opportunities, and we're doing a bunch of different things with regards to geospatial analyses and getting students involved with GIS research and really getting hands-on experience with ArcGIS and a lot of other visualization tools. We are partnered with Voters Choose, EDGC, which is one of our, currently partnered with one of our different projects focusing on the implications of COVID-19 in South Korea. And then we're partnered with numerous other partnerships, including Opportunity Insights, the COVID Foundation, Groundbreakers, which is making a community resource map that lists all the different resources available to people in their community, and is currently prototyping an app so that people can easily go on their phones and develop it. We're working with in collaboration with them. We're partnered with organizations like CryptoChicks, Harvard for All, the Intercollegiate COVID-19 Coalition, and then numerous different organizations at Georgia Tech, like Data Science at Georgia GT. And then here's some of our published work. Lucas, yeah.
Yeah, sure. So when it comes to these partnerships, basically, of course, we're trying to expand, and that means we have over 100 universities that we have members from, which usually means that we have some sort of connection with the organization there. And as mentioned with EDGC, we're trying to connect with a lot of these data partners. For example, in this case, EDGC being one of the biggest producers of tests. So I'll just quickly go through all these presentations, all these slides for the sake of time. So first you saw Georgia, which everything started. We're doing tracking, also looking at economic, go to the next slide, and social effects. And these are all underneath different resources that we're trying to provide, such as this community resource map that Scott mentioned. So there's over 30,000 elements there. We're trying to turn it into an app. We're also really proud of Supply Crate. Over 350,000 articles of PPE have been donated through this website. And we're also partnered with numerous PPE organizations trying to optimize each donation, and especially trying to reach now secondary needs such as nursing homes. We're also trying to share the wealth of the opportunities and links that we have. So we have an Airtable of resources, anything from visiting the Vatican to getting Minecraft for free to university courses. So we're very much about keeping everything open data, open source. So just quickly going through the projects, economic project is the biggest. We have 6 different sub-projects within there because we tend to think these socioeconomic measures are more objective and allow us to look at different things such as how protests might have affected infection rates, looking at how different counties have been affected, especially economically, looking at small businesses, looking also, go to the next slide. Sorry about that. Also at other interdisciplinary issues like climate change, specifically trying to fact check the EPA. So again, with this whole theme of being objective and looking at quantitative measures rather than all of these previous qualitative analyses, because they help us find the bigger picture. One of our products will include a dashboard, and we're also doing infection prediction. And in this case, we're working on ranking models instead of just creating new ones. So that creates a higher level of accountability, especially when it comes to research scientists and the public.
And yeah, so that's pretty much, we have a bunch of other different projects, but we're not going to go through them all right now because we want to save time. But really our ask today is in terms of how we can sustain what we're doing in the long term. We really want to focus on long-term growth and longevity and long-term sustainability to really keep students active and engaged in our mission and what we're trying to do.
Excellent. No, terrific. Thanks for having me this morning. My name is Peter Zhou, co-founder of Anna, and we designed Annbot as a social platform with a clinical impact that helps isolated seniors get reconnected to the community, discover and embark on new journeys and adventures that helps them to reduce loneliness and isolation. I think we all at one point in our lives experience loneliness, and the pain it puts us through. Now imagine you're a senior and going through life transition, having recently retired from the job that you worked at for 35 years, losing that sense of purpose and community, and watching the important things like mobility and health slowly trickling away from you. Loneliness exists in all communities in different forms and facets and shapes. And being chronically lonely means that you're susceptible to a higher chance of getting heart disease, cardiovascular disease, dementia, and in some clinical studies, it even shows that it's related to early death. Now, this is what inspired us to build Anna. So Annbot is a one-touch voice messaging companion designed to help isolated seniors engage with community volunteers and navigate social activity information, thus leading to meaningful impact. Access to information has never been easier. Now, we don't have to wait until this problem becomes more and more catastrophic to intervene, to do something about it. And that's ultimately where we think the value of the platform comes in. By being digital, we're able to identify through conversations, through text analysis, when is the right time, the right level of attention and care. So a simple gesture like suggesting for a walk or a quick conversation can actually have a lot of positive impact on a user's sentiment, thus reducing their mental burden and reducing in the long term a negative adverse impact on the healthcare system. Now, a bit more about the venture and the business model. I think there's a tremendous number of seniors in the world who needs our help, and we need help from everyone to reach all of them. As much as we want to extend this product to the globe, everyone around the world, we're focusing on English-speaking nations at first, and we intend to generate revenue by creating a significant social value. So from one perspective is having the greater social network and thus social resiliency within each senior, but also making accessibility to network information, healthcare information at a touch of a button with a voice command. And secondly, what's really exciting to us and to a lot of the clinicians we partner with is the ability to actually generate predictive health insights and leverage this insight to help them with the medical prescriptions and turning this into both a social medical prescription to aid some of those seniors that's going through life transition. We've worked extremely hard just prior to COVID-19 with a number of different partners in the Calgary, Canada region, looking at partnering with community hubs, activity centers, and co-creating and getting the seniors involved in designing what's meaningful, impactful technology to them. And since the unfolding of COVID-19, we've actually partnered with a number of different health organizations and social support organizations here in Calgary in virtually rolling out our service. Now, one thing I would like to talk about is, who do we compete against? And I have to say, rather than talk about competitors, it's much more important to view the status quo as being the competition. I don't think we're putting enough emphasis on the health and well-being of our seniors, centering the design of technology around them, and more importantly, taking important actions. And that's why it's still a challenge before COVID-19. That's why loneliness and isolation is still a challenge during this time. And hence, that's why it still will be a challenge after this phase as well. So this is where we think Annbot as a digital platform could really shine by taking all three boxes and augmenting a bit of human and machine intelligence in trying to solve this problem of being a piece of puzzle in the ecosystem. I won't dive too much into our team, but we come from a number of different backgrounds and expertise, and we're just really excited at leveraging our networks, what we know, and collaborating together to piece together a meaningful conversation so that we could create a sense of comfort for every senior that uses Anna. And second last slide here, just a little bit on some of the traction and what we think are extremely important metrics. So looking at things like weekly active users, even the number of user-driven interactions, those are extremely important and meaningful insights for us to understand how much a senior would value a service like this. And more importantly, what we found during COVID-19 is how we're able to change a negative behavior from a senior in a month of time. And over 24 hours of use, we're able to actually increase user sentiment. So that's a little bit of taste of Anna and what it is today. Going forward, I have 3 asks for everyone. We're always keen to get tied into additional users, help reach the lonely and isolated, engage in research and testing opportunities with various partners around the world. In our venture, we're looking for a third co-founder with a healthcare background who could help a little bit on the marketing and reach side of things. And we're always keen to connect with volunteers and people who like to help in any way, in any collaboration. So thank you.
Okay, so I had posted from the start that we want 3 people to join each of the small teams in addition to the mentor and to the co-founders. So I will be setting those up. So if you have a little bit of time to let me know which team you wanna join, just send me a little message. Okay, so what we're gonna be doing now is going to breakout rooms. So what's gonna happen in the breakout rooms is that the mentor is gonna ask the co-founder or the founder for like, what is your specific question that you're trying to solve with this MVP? Okay, after having that answer, then the mentor is gonna give some feedback in terms of what is working, what is not from the MVP. Then the participants are gonna have time in order to help the founder a little bit more. So give specific feedback on what works and what is not working for them or what they didn't understand. Okay, so the way the breakout rooms are gonna look like is that you're gonna be obtaining feedback. So 3 teams, each for one of the MVPs. People from this team are going to be helping out. So as we advise, so I was trying to select the 3 people that send me the messages from each. And they're gonna have the mentor in the main room. So whoever is in the main room left, we're gonna be doing a talk about Wix and how to use Wix. So let's see.